Welcome to the Cervical Health Series. I'm Vivian Kopsinje-Birchall, your host, and it's such an honor to host a team of very diverse personnel from across the continent of Africa. Specifically, I think we have guests from South Africa and Kenya. But to start, I would like to invite each and every one of you to please tell us who you are and what you do. And I will call out one person at a time based on who I see on the screen. I will start with Abba.
Right. Vivian and other colleague, good afternoon. Thank you for giving us an opportunity to share our part of story here in Africa. So my name is Abba Jamalum. I am a clinical radiation oncologist practicing in South Africa. And majorly, I have a biased interest of reducing cancer burden in Africa and low middle income country in terms of access to care and also evidence-based in terms of research. And we want to just narrate the story of Africa to the world. So that's what I do, and that's why my interest base.
All right. And Faith?
Good evening, all. My name is Faith Nsami. I'm a cancer survivor. I'm 42 years old. I work in a water company back in my country, and I'm very happy about this forum, and I'm willing to talk, educate people. At least people should know what the challenges we are going through, what we need to be assisted, how the country can help us. You know, I'm a victim. I know what I've gone through, and I'm happy about this session. I know we are going to talk more and interact more. Thank you so much.
And Faith, where are you calling from?
I'm calling from Kenya.
Asante, thank you. So we have Rakia next.
Yeah. So my name is Rakia Saidu. I'm a trained gynecologist and have interest in cancer research, which is currently what I'm doing over the last 10 years. So I'm working in University of Cape Town as a senior clinical research officer. And I'm working with a team on cervical cancer prevention. And the team, it's a team that has been existing over the last 30 years. So I joined the team 10 years ago. And the main focus of the team is to find resource compatible, but also the top of care. So while we are looking for things that our resources can afford, but we also want the best. So in terms of cervical cancer screening, that's what we have been doing. And our team has written a lot of papers and has made impact on how cervical cancer is prevented and how we should go forward on the African continent and other low and middle income countries.
Thank you. And last but not least, Bilinga.
My name is Bilinga Tendwa. I am a clinical phytomedicine practitioner, but also a PhD holder in bioinformatics, where I specialize in pharmacogenomics of cancer, how the drugs we take and the genes interact for the better of how our body interacts with them in terms of healing of cancer, the treatment of cancer. But my special interest is in issues pertaining to globalization and health, more specifically equitable health for all. Yes, so I have joined this forum just for us to put our mind together, you know, based on the ancient African word, the famous word of Ubuntu, which means humanity to others. I'm what I am because of who we all are. So if we put our effort together, then we can be able to address the pandemic of cervical cancer. Thank you.
I like the way you phrased it, the Ubuntu philosophy. And with that, if we're what brings us together today, at least, is cervical cancer. So I'm going to put you all on the spot a little bit and just tell us not briefly, but in your language, when you're communicating to your people, how would you describe cervical cancer in your language? Starting with Abba.
Right. So, being as a clinician who actually I'm on the end receiving, most of my work is just we see the patients already with an established diagnosis of cervical cancer, which actually most of the patients have been referred by our colleagues from gynae or gynae oncology. And of course, more often than not, for us to express it is just to tell them that they have a cancer in their womb or mouth of the womb. Now, before this cancer, we will express this cancer. Most of the patients, they have presented with symptoms, especially in Africa, because of some of the challenges we have. Most of our patients present with the advanced disease. By the time when we see the patients, they have a stage that probably they can either be, half of them can be cured, half of them cannot be cured, for a disease can be preventable. So this disease is preventable by just getting a vial of a vaccine. But unfortunately, due to our health sector, due to lack of information, due to lack of implementation, working collectively together, so we have a kind of a health system in the Africa where disparity make it based on our geographical location. Some patients are getting advantage, some patients are left behind. And being as a radiation oncologist, one of the key points that I put attention, out of the 54 African countries, we still have countries that doesn't have a single cancer center. So patients from those countries are being disadvantaged. Now, the best way for us to do collectively is looking forward on how can we do much on the preventive part before they will even get the disease.
All
So
right.
this is the journey, but then if it comes to the treatment, I believe that I will just give an overview. The treatment of it is either if early disease, which very limited of our patients are early disease, they got surgery, and that can be potentially curable. Then when we get it at the clinical level, where most of our patients, especially in KwaZulu-Natal, where I base and HIV is pandemic, we have more than 40% of our patient load are cervical cancers. Now, those patients, out of the 40% of the total patient we are treating, more than half of them, we are palliating them. And what I mean by palliative is we're going to not cure the cancer. We will treat them with radiation to just give them a symptom control. Right. Now, these cancers, if you get them early, they are potentially curable by giving them radiation and chemotherapy. And radiation is a kind of an X-ray that we call it external beam, treat the patients in a specific positions, which is quite precise, very specialized, with an ionizing radiation that will interact with the cancer and kill the cancer, while we will give them chemo to sensitize them. And this treatment is given over a period of 5 weeks. Every day they get a smaller portion of radiation, and that will last for 5 weeks, followed by an internal treatment known as a brachytherapy. Now, one of the things that comes through because of the waiting time, which has an impact on the survival outcome in our setting, we are looking at that is what we call a hypofractionation. So the normal treatment is known as conventional treatment, where we give a smaller portion of radiation over a period of 5 weeks. However, we are looking at an option in terms of, we say, access to care. Waiting time in Africa across, if you see, every country have their different waiting time, but in average, most of the data we have a waiting time of about a minimum of 6 weeks to up to a year. And some centers, you will be diagnosed with a cancer and your waiting time is more than a year. So these cervical cancer are very aggressive. By the time you see your clinician and establish the cancer, waiting for the treatment will just is as good as telling you a death sentence, because that waiting time is adequate enough for the cancer to migrate from the original site of the womb to the other regional part of the body. Either it can go to the lungs, it can go to the liver, and cervical cancer are quite they have the propensity of doing that. So in our setting, what we are doing is we try to do a hypofractionation to some of our patients in order for us to give access and also not to compromise the treatment outcome. And in the setting of the palliative, of course, we do the hypofractionation for them so that we can get as much patient as possible in order to reduce their waiting time and have an negative impact on the survival outcome.
Thank you, Dr. Abba. I think I'm just going to rephrase also the question for Dr. Rakia and Belinga, but starting with Rakia. When a woman, when patients come to you, female patients, what are some of the fears they share with you, or what are the trends that you see with the patients? And while she's answering that, and Faith, just start thinking through some of your experiences, and we'll come back to you very soon. So Rakia, to you, and then Belinga.
Oh. Yeah, so because patients I see don't have cancer yet, and although some of them we pick the cancers, as during the screening time. So women have a lot of issues, and I tell you that what we primarily do is to do screening. Women come with many other issues from home, issues with family, issues of violence in the home, issues of children, issues of drug abuse, issues of themselves, their health themselves. Women are like very busy; they don't have time for themselves. So when you are able to catch them when they come, there's something that made them to come. Usually there's something that is a little abnormal, but sometimes even though some will tell you that, oh, I've been having this bleeding for about 6 months now. And some will tell you that I have been to many other clinics, I have been seen, but I was just given drugs to go home. So it means nobody looks down there to see what is going on there. And one thing I think we should all realize is that and across most of the African cultures in particular, we don't want to talk about that place because it's even called a private part. So people don't want to talk about it. So when they come, they're not coming to talk to you straight on about it. If there's something there, they go around first before finally you are able to bring it out. So they won't tell you about it because it's supposed to be private. I remember when I joined our team, the main PI on our studies, Professor Denny, said when they started the work in the area, it's dominantly African people, and women are shy. They don't want to open up to get examinations done. And when they are being examined, they cover their faces. So they try to bring it out. Why are women like this? Why do they feel so ashamed of that part of the body? So they had these interviews with the ladies, and some people think, oh, it's just a dirty part. Oh, no, it doesn't belong to me. It belongs to my partner. So I don't have anything to do with that. So they've heard a lot of that. And at the end, they work with some of the traditional healers in the area and some of the traditional singers, and they formed a song where they try to tell women that, look, your vagina, that part is important, and that part is the source of life. Everybody is born there. Kings and queens and the presidents are all born from there. So it's not something to hide. It's not something to be shy about. If there's something wrong there, you must talk about it. So, but still, we still have that. So there's that issue of people not wanting to come forward when it is issues of that area. And then most people when they come, so some will come for screening, they have heard from other people Some get worried that it is something they can pass on to the children. Some will come to screening because the mother or a family member died of a cancer. It could be any type of cancer, but that will make them to be aware to come and say they are coming to have a screening done. We try to talk to them first to go through what is even cancer. So we tell them that, look, it is a growth. Our cells, we try to explain what cells are, which is so difficult, but we try to explain. And then say those cells usually change, but sometimes they overgrow. Normally they die, and new cells come and those ones die. But when there's a cancer, those ones, they refuse to die, they continue to grow. And when they grow, they distort, they spoil how that area works. And they can detach and go to other places and also kill off those areas. And then now we can go into the symptoms and talk about symptoms. And there's a lot of questions because some of the symptoms are so vague that that they need to be clear. They need more clarity on how things are explained to them. So we also talk to them about the vaccines. If we get the mother, we talk to her about vaccinating her child. So in South Africa, the vaccine is a school-based program. So we talk to them about consenting for their girls to have the vaccine and for them to screen and then to invite their friends and their groups. So some of them, we luckily, I think because of the way we have been talking, one lady has opened a big Facebook page where a lot of women join and we talk about this cervix, and she tries to send them to us to come and screen. So I think we just need to keep talking about it. And as we talk about it more, people will understand and they will respond to us.
You have mentioned so many important things that we can get back to later because it's not very unique to South Africa. It's happening in Uganda, I think in many parts of Africa. But I'm going to give Bilinga an opportunity to also share what your observations are. Earlier you talked about the equity angle. So if you could bring in, you could give us your perspective with that equity lens that you spoke to earlier.
Thank you so much, Vivian. First of all, just to, as Rakia said, it's very difficult to talk about issue concerning cervical cancer. Actually, we direct in many African language, a direct translation will mean just cancer of the mouth of the womb. And that is what you would want to explain when you're explaining to so many females. They don't really know what this is. So you have to use the most simplest term that you can ever find for them to understand and for them to know why do they need to get vaccinated. And before you even talk about vaccination, they'll ask you why. And then you have to tell them, how you are vaccinated in things like COVID, because it's caused by a virus and you can prevent this virus by vaccination. So the same way applies to cervical cancer. Cervical cancer is most caused by a virus that attaches to the womb and grows and uncontrollably, and then it results to cancer. But if you vaccinate, then the chances of you getting this virus attaching to your womb and growing are very minimal, close to nil. So once you tell them that, then they begin to understand. Then you have, as Rakia said, if you want to address them, maybe addressing them directly, there's a taboo, there's a stigma on issue concerning cervical cancer. So if you want to address them, you have to go through maybe a leader. Sometimes you go through church leaders. So we have devised means of spreading this information to them. When we talk about equitable health to all, in Africa, you find that most places we do not have, first of all, we do not even have resources to spread this information. So you may talk, most of the health personnel are based in urban areas. So you find that in rural areas, some have to like drive long distances to get to urban areas for them to get even just screening and treatment. And you find that most of them will come for screening when it's too late, when they are, now when the disease has really spread, when they are bleeding, when they even don't know what's going on with themselves. So the pain threshold is a bit high on them. They'll overlook other things because due to limited resources, they'll rather forsake treatment, maybe for the betterment of their children, to take their children to school, to provide food for their children. And most African countries also, as much as we know, health, like, in terms of it's not free for all. Like sometimes you go to other facilities, even government facilities, you find some other African countries that are doing very well, but not all. In some countries, you have to pay for you even to get admitted to hospital. And some people don't have that money, even for you just to get to see a general practitioner. And if you don't have that money, then you will not seek for treatment. You will not even get to the stage of screening to know that you have cancer. We are saying, we want these screening programs, we want these vaccination programs to be affordable to each and every woman, even the ones who are at the rural areas. We want these facilities not only to be found in urban areas, we want these facilities also to be designated even in the rural areas, so that we can get access to screen we can get access to vaccination, and through this, then we can eradicate cervical cancer. Thank you.
Well, thank you, Belenga. Again, there are a lot to unpack, but before we unpack all these issues, this is, I think, a moment to hear from Faith. And Faith, I'm going to leave this open-ended and just invite you to share with us your journey. Like, when did you have symptoms? What made you decide to seek healthcare? What was that experience trying to get services up to where we are? Just take us through that journey, just so we can understand that.
Okay, thank you so much, Vivian. First, I want to really appreciate you so much for giving me this opportunity to share to the world about what really cancer is. First, my journey started in it was just like any other day. I could feel like abdominal pain. It was not something that I had seen any type of symptom, but it was just like every now and then I could feel on my left-hand side, I could feel some very harsh pain. So I decided to seek medical attention. And something very funny, wherever I could go to the hospital, they could tell me that I have infection. So I treated infection for 4 months without any recovery. So one day I just decided to change the hospital. I went like 2 kilometers to a different hospital, and a private hospital. On getting there, that doctor listened to me and he advised me to do a CT scan. That is now when they told me that I have a growth in my uterus. So they advised me, like, can you accept to do a surgery, because the growth was very big. I said, yes. Do you want more kids? I told them, I'm a single mother with 2 sons. I don't want more kids, because I'm even straining to educate the 2. So I went for a surgery. It was successful. I went back home. So after 1 month, I went for checkup. On getting to the hospital, they told me, can you go for your result at the lab? When I picked the result, I saw something and I was like, there's somewhere I saw something like this, HM03. Hey, I was like, what is not wrong? So I took to the doctor. Unfortunately, in Kenya, we have doctors who don't mind about what they say and the repercussion. That doctor just faced me on my face and told me in my mother tongue. In my mother tongue, they called a mother Mai. Mai, you have cancer. I felt like it was the end of the day. End of my life. I looked back at my children. I looked back at my life, how I've been straining. Then I was like, oh my God, why me? And remember, I still had a wound that was not healed up. So he just told me, go to the hospital for checkup. So he referred me to a hospital, like it is far, like 8 hours, very far from where I stay. I was with my mother. I remember I really cried. I really cried for like 5 hours. But on getting at home, I remembered I had two candidates. I had a candidate from 4, and I had a candidate doing the 8. It's called 11, class 8 in our country. So when I looked at him when he came, and my eyes were very red and swollen, you can imagine crying for 5 hours. So he just asked me, Mom, what is the problem? I told him, the doctor has just touched on my wound and it is very painful. That's why I've swollen on the face, but I'll be okay. So I had to start the journey for treatment. I was referred to a farthest town in Eldoret to go and do the checkup. I went there, I traveled, and you have to travel and you have a wound. That's training. So it was really scaring, even after people had talked to me, but I was not accepting because I have seen people dying of cancer. I have seen my friends dying, so I knew I was going to die. And I was telling God, why should I go through this? It is so touching and so harassing. So I went to Eldoret. I met an oncologist there. He gave me hope. He told me that, you can be treated. He told me that you shall do some blood tests. We shall do for you chemotherapy, radiotherapy, then you'll be okay. But now what made me not to get the treatment in Eldoret, it was because of the cost. I was given a bill of 400,000. That is the total cost of the treatment. That is radiotherapy, chemotherapy, and brachytherapy. And this should be done in different hospitals because now they were telling me for radio, I have to do radio every Monday to Friday. Then chemotherapy, the day I do chemo, I'll do the radio. Then the following day is radio. Then it is like you are not admitted. So that cost of, you have to do radio today, come back to Kakamega, go and do another radio. I could not make it on the cost. So I decided I cannot make it. I told the oncologist, it is too expensive for me. I can't make it. I have to go back to my home, look for some fundraising so that I can be able to get the treatment. I went home and I stayed for another 1 month looking for funds. You can imagine. I stayed for 1 month. I created WhatsApp groups for people to assist me. Back at work, I talked to my bosses. They were not like, nobody's believing you're sick because me, I've maintained my body. There's no day I have cut. It was just me. It was really bad on my side. My family members were tortured psychologically. I have candidates, they have to sit for exam. It was really disturbing. So I just went back to my church. I remember I stood before the church and I told them, I want you to assist me. I cannot die and leave my sons. Then they told me, we are going to help you. So we created a fundraising. My in-law told me, you cannot be treated in Eldoret. It is very expensive. At the same time, you don't have the facility. Even where do you sleep now when you're doing the radio session? So I had to travel to the capital city of Kenya, that is in Nairobi. I was taken to a different facility. On reaching there, the oncologist told me I have to pay. Anytime you have to go and see that oncologist, I have to pay Kenya shillings 4,000. For me, just to tell the oncologist, this is my problem. I have to pay. Already we had not received the other amount from the contribution. So I talked to my in-law. He told me it's okay. I can try and do my best. He paid for me 4,000. I went to the oncologist. He also gave me hope. But now I don't know what happens with this hospital because in Eldoret, I was told I'm in stage 3B. Coming to Nairobi after doing all those tests, I was told it is 2B. Now I asked, how do you measure the stages of cancer if a patient a patient has been diagnosed with cancer? How do you say is it stage 1, 2, 3, or 4? Because now these are two contradicting information. He had to consult. Then he told me, no, Faith, you're in stage 2B and it will be okay. So I was told to go and do blood tests. I do ultrasound. I do MRI so that they can check if the cancer, they remove the uterus. So they said that the cancer has slipped into the cervix. So they had to identify, has it gone to any other part of the body? So good enough, there were some cells at the cervix, and they told me, no, it has not gone up to the organs, the heart, the stomach. It is at a place where we can manage. I started the treatment. I'm telling you, it was not easy. It was very tough on my side. I could do a radio. I travel like now where the person who can accommodate me, I have to pay 1,000 daily. That is one way. The second way, I have to pay 1,000. You have to take a cab. Because, you know, in Nairobi, if you have to go with time. So imagine I could wake up at 3 a.m., get somebody to carry me to the hospital. I pay 1,000. After all the exercise, I pay 1,000 back. The following day, when I have to see a doctor, I pay 4,000. You can imagine. It was really costly for me. And the only place where I could be assisted well, it was through a private facility. If I go to the public facility, you can be treated today, you are being done radiotherapy. Tomorrow, the machine is not working. You now skip. So my in-law told me, I can only assist you in this private entity if you're doing fundraising on all that, all those help. We can get money, you go to a private hospital. And this private hospital, it was because of the Harambe I had done and the WhatsApp. So I started my radio. I was told to do radio 5 sessions, 5 sessions of radiotherapy and 6 sessions of chemo. Then after that, I do brachytherapy. I started doing the treatment. In between the line, I got short of funds. I had to stop. The doctor told me, now because you don't have enough money, we cannot do the sessions we had told you. We have to increase the radio. We have to increase the chemo because now you started the treatment and you stopped on your way. And the experience was not good. I could be scared at times after the radio. I feel like I want to, lack of appetite. The body is just too weak. Then I really swelled. I was very big. I ended up weighing around kgs 110. Reasons they could not tell me why. So according to me, I could say maybe it is because of the treatment that I was going through. But generally, the treatment was not good. It is a tough experience. When I look back, all my friends ran away because they knew I was going to die. I was only left with my 2 sons, my family members, and part of the relatives and the church members. It was not an easy task for me. People could gossip that, you know what, he's going to die tomorrow. Only that gossip that he's going to die tomorrow, it's already killing you. But I thank God because I could tell myself, I'm going to heal. There was a song I could tell myself, Faith, you have to heal, come back, give a testimony. Go and take care of your kids. That is the only thing that made me to be what I am. But generally, I have suffered financially. And I really wish people could put that much consideration on cancer. I've seen my friends die. I really suffered financially. I really suffered psychologically. And then something very funny, nobody could talk to me, even my doctors. Nobody could encourage me like this tomorrow. You'll get to tomorrow. You'll get to this tomorrow. You're going to be healed. You're going to be okay. I didn't see that coming. Recently, I had another problem. Now I don't know if it is the mistake of doctors or what. When I went to the hospital to do total hysterectomy, when they removed my uterus, I had an ovarian cyst. And I asked the doctor, have you removed the ovarian cyst? Because they told me it was big. Do you know, 2 months ago, no, 1.5 months ago, I went back to the theater. They told me when they were removing the uterus, they left some cyst that had grown to 6 centimeters. And they told me it was an emergency. It again killed me because I imagined going back to the theater. I did my 2 kids, I delivered them through cesarean. I did total hysterectomy. The 4th one, they're telling me they have to remove the cyst. Then go and do a biopsy. Then I ask myself, now if they do the biopsy, then they find that I still have cancer, for real, I'll be dead. After doing that, the removal of the cyst, again, there was a complication. They did not do the operation well. I went back to the theater. They're doing 2 surgeries in less than 1 month. It was very traumatizing for me. I have really suffered. It is not an easy time for me. I have really suffered. Then back at work, nobody understands that you are sick. At times when you take these medicines, you feel drowsy. You cannot work the way like you're supposed to be working. Nobody is understanding you. So there's that system where people have to be sensitized about, like, when somebody is unwell, try to encourage this person that you'll be okay. You'll be okay. Even if it's a place of work, people should be sensitized about how to deal with these cancer patients. You see, like me, I'm told to go back to work. And right now, I've been a surgery, it's less than 2 months. I'm supposed to be at work. If I don't go back to work, I'll lose my work. I am a single mother with 2 kids. You see, I undergo a lot of torture financially. People tend to ignore you. People tend to see you like somebody who wants to create a way of getting money from them. They don't remember that you are sick, and it is true. You know that people up to this time, they know there's no cancer. They say that you are bewitched. You know, there's that sensitization that people have to be told. Cancer is real and it can be treated. It is something that if you get it in the best time, it can be treated. It is never late. I remember a month ago, back in my country, my uncle was diagnosed with prostate cancer. I really felt bad that I had to lose my uncle because lack of facility. He didn't get enough medication. Today he goes, there's medicine. Tomorrow he goes, there's no medicine. And you see, that is the same problem that I also had, but now mine was financially. I was to undergo the 25 sessions of radiotherapy and 5 sessions of chemo, but I had to go up to 40. Why? Because I missed some sessions, like 2 weeks, you cannot go for checkup. So I did 40 sessions of radiotherapy and 8 sessions of chemo. Finance. And I really wish back if our leaders can put major priority on putting cancer as a basic treatment for everybody who is diagnosed with it. So generally, my experience has been very bad. Put in mind, I'm the mother, I'm the father to the kids. Like right now, I was told I'm supposed to do a PET scan. I have never done it because how can I do it? I don't have money. If I go to any hospital, they tell me, get money. They were giving me a total of around 85,000 Kenya shillings. Then I ask myself, where do I get this money? Do I pay for my children's school fees or do I have to pay for these things? You see now, it's now like 1 year down the line. I've not done it. That was the last statement I was supposed to go and check for the confirmation so that they can tell me you are now cancer free or we have this problem, you have to be assisted. So my real big cry is that our government to help cancer patients and then to sensitize people the importance of screening. People tend to ignore screening. Yearly screening is very important. And then that vaccine, I've heard there's a vaccine in South Africa. I thank God at least there's some opening, people are doing that. In Kenya, I've not really heard about it because even where I stay, I've not heard about it. So you see, it's like people that are supposed to be sensitized, the importance of doing the vaccination to people before the certain age where they can be affected or get the infection. So that is the story I have. And I just have to repeat that I'm very happy because whatever I have gone through, I'm telling you, it is pathetic. Like you see my hairstyle. This is not it is a hairstyle that I created because ever since I did chemo, this part, there's no hair. It totally refused to grow. So what I had to do, because I have to live and encourage people that you can live, I had to create this style. It's not my style. It is a style that has been caused because of the situation. So I have to live like this. There's no hair. It doesn't grow completely. It grows just a little. So I can't do anything apart from shaving this. Then I still have problem with my body. Generally, my body is not the body I used to know. I always tell myself, maybe there's something that I have not done. But you see, how do I do it when there's no funds? How do you complete the full checkup? If I have to go and see a doctor right now, imagine I have to travel from Kakamega to Nairobi. Then get to Nairobi, get a doctor, I pay consultation fee of 4,000. Any complication you have, you pay consultation fee before you see an oncologist. If you go to oncologist needs 4,000. The person in charge of radio needs 4,000. Where do you get the funds? So I just thank God that this forum is going to make people know that how people are really suffering. How do we help these people? How do we sensitize? How do we make cancer treatment affordable to everybody? How do we encourage people to go and do the screenings? How do we encourage people the importance of vaccination? It will really help us. I can never wish anybody to undergo whatever I underwent because it is bad. It is bad, and that is the worst. A lot more so if you don't have funds.
Right.
If you don't have funds, you will die. People die not because of the disease, but people die because they cannot afford it. They cannot make it to these good hospitals. Like where I am, only good hospital will treat you well. But if you don't have funds to go to the good hospital, the government hospitals, nothing completely. You will just die. Right now, our doctors are on strike. You can imagine anybody who was supposed to do chemo has missed a session. Anybody who was supposed to do a radiotherapy has missed a session. You now go back to square zero.
Right.
So that is what I feel.
No,
And that is my story.
thank you so much for sharing that story, Faith. I mean, it's important for all of us, even us who are on this panel and our viewers, to understand and appreciate your story, and which reflects on other stories, not only in Kenya, in rural Kenya, rural South Africa, rural Uganda, where I'm from, and the importance of finding these holistic issues, the cost of treatment, cost of transportation, bringing services closer to the people. And I guess one question before I piggyback on that, as others prepare to talk about, some of in the advocacy work you're doing. This is an advocacy group. Like, what are some of the key issues, very, very briefly, that you want to highlight in your advocacy work? But before we get to you, Faith, one question I have for you is, before you got, the symptoms for cervical cancer, had you ever heard of the disease? And two, had you ever gone to the doctor for other, women health issues and checkups? And if not, what kept you from doing that? Just very briefly.
Oh, I had heard about cancer, it's true, but I didn't know it can get to that closer to me. I didn't have any other problem. For just to inform you, the symptom I had, it was just an abdominal pain. I didn't have those signs and symptoms like mucus, wart, over bleeding. I didn't have that. It was just a very sharp abdominal pain that had lasted for long. And I had visited several facilities without help. Only one gynecologist had now advised me, now try and do this so that we can see if we can be able to get where your problem is. Yeah.
And before that, what was your relationship between going to the doctor just for general checkups, not when you're sick, but how women go for, you're a mother, you did probably prenatal visits. When did you decide? Basically, my question is, when did you decide to go see a doctor about women health before you had any symptoms, if at all?
Oh, I have never visited a doctor if I don't have any symptoms. Like it has never been a routine to me to go and see a doctor. I go to a doctor when I feel maybe I'm unwell. I don't have, I think according to me, I always felt I go to see a doctor when I'm feeling unwell. But that random just visiting a doctor, I had never done it before.
Absolutely.
Yes.
Yeah, and the reason I ask is, we're going to be giving an opportunity to the advocates to just to talk about this kind of, it's a lifestyle of sorts. Many women, not just Faith, in our countries, we don't have that habit of going to the doctor for wellness checks. And cervical cancer,
Yes.
again, you don't feel any pain until the symptoms, when the symptoms start exhibiting, it's in the kind of late stages. And so as again I think I'll start with Bilinga this time, and we go upward. What has, as an advocacy group, what are you focusing on? What are your priorities in making sure that we save women's lives through early diagnosis or increased screening, early diagnosis, and all that?
I would say it's education, because most women in Africa are ignorant of cervical cancer. So it will be, as an advocate, I would want them to be educated. I would want them to know, first of all, to understand what cervical cancer is. I would want them to understand they can go for regular checkups. In other countries, the checkups are there. You could go and get checked. But in other countries, it has become very, as from the story of Faith, we see it's not easy. There's no facilities for checkup. And what we want to advocate for is for government to partner even with private sector so that we can make this very, very affordable in our hospital, on free for women, so that women can come for screening. And first of all, even before they come for screening, they have to know why they should go for screening. So education to me is more important than anything else.
Thank you, Rakia.
Yes, I think that is the basis, educate, educate, educate. So because you see, post-COVID, or rather during COVID, there has been so much negative information about health generally, and so much fake news, so much, I can't remember the word not used, but so much wrong information, so much fake, false information, so many myths for everything, not just COVID, for everything, including cervix cancer. So in December, when I traveled home is Nigeria, and we had an introduction of a HPV vaccine, and there's so much story about it. So I went on the radios and started talking in my local language, Hausa, to them about it. And you'll be surprised that it was an open call-in message. So people were calling in. I had many programs like that. And in each of those programs, people called, even from the villages, saying, but we didn't know that it was like this. We didn't know that this is it. So people don't know. We have to give them the correct information. If we don't give correct information, the fake news will get to them first, and then damage is done, and it's very difficult to convince them. So we must keep talking. We must keep talking on top of our voices. We must keep sending the messages in every single platform of the correct information about health generally and about cervical cancer.
Thank you. Abba?
Yeah, thank you, Vivian, once again. And Fed, very sorry to hear about your journey with a lot of, trauma. And that is a typical of what is happening in Africa, not only in Kenya, but if you go to other part of Africa, getting a delayed, or either you presented yourself to the hospital, you have been going in and out of the hospital, but then again, you are not being told or either being diagnosed on your early presentation. That is one of the challenges. How do we address those kind of challenges? And through collaboration, improving education. And that education, of course, we will have to collaborate and improve in terms of the training of the health personnel. You will get a lot of health personnel. They might be aware of it, but some of them, they have not done their cervical cancer screening. Don't be surprised to get that. So I think it is going to be a form of education, and I will say that we need to collaborate within the healthcare practitioners, advocacy group, get the knowledge and spread the right information using a platform targeting a specific, in the schools, girls' child is a good target population. We can leverage, there is an excellent HIV partnership with the paper clinic in Africa. We can advocate using those platforms because they have a structure that is existing, and that structure has to be proven excellent. We can use those platforms and then leverage and also advocate for female screening using antenatal platform. Using those platforms is easy to get the target audience and also give them the right information. Now, when it comes to if we deal with the healthcare practitioners who have the right information to share with the target audience, we need to also bring the public-private partnership. if we leave everything to the public sector, leaving the government in different African countries to do, it's not practical. There are so much to do. Therefore, I think the private sector have to identify, come together with the public sector in order to find an ecosystem whereby the common ladies and women and men in the country should benefit. And those ecosystems have to do with the collaborations. It could be in form of a collaboration, in form of partnership, in form of bring something 50-50, and let's see how we can make this thing work.
Yep.
So these are the kind of things that I think, looking at it in summary, we will say that education is the key point. Educating the healthcare practitioner, unifying whatever works better. For instance, in Africa, we have a good example. In South Africa, there is a reasonably some of the state or province are doing very good. When you see Rwanda model in terms of the vaccination, it is excellent model. They have covered very, very reasonable. Botswana have done so much. South Africa, they are targeting the school child, but still we have a good number of women that need to be vaccinated, a good number of women that need to be screened. So in my own way, I think I will say that partnership, educating the healthcare practitioners, targeting toward the, a kind of a primary target like antenatal, collaborating with an HIV, the paper clinic in order to use their facility that is already existing for us to use that platform and reach to the target audience will make us to reduce cervical cancer in the next 10, 20 years coming.
Right. I mean, this is so, again, humbling because there is so much to talk about, and yet we are almost up to the hour already. Time flies when, good conversations are being held. But I know that we haven't even talked about what the advocacy group is and where it's located and how people can be a part of it. But I guess that's another reason for us to come back, I guess, for another one, just to not extend this beyond 1 hour for now. But I wanted to first ask each of you, we come from different parts of the world and we speak different languages. Can we each please say what cervical cancer is in our local languages? I'll start with Faith. Did the doctors talk to you about cervical cancer in your local language at all?
No. They didn't use my local language. They just used Kenya. That is the language, Kiswahili and English.
Yeah, I meant Kiswahili. Okay, let's do Kiswahili. Can you describe it in Kiswahili?
It's called, let me remember the name. Oh.
Can I help with that? Because I speak Swahili too.
Yes,
Oh,
please.
you do?
Yes,
Absolutely.
yes.
Go for it.
Yes.
Yes.
It's called saratani ya shingo la uzazi.
Saratani, yeah.
Saratani ya shingo la uzazi.
Okay. See, the reason I'm doing this is because many of our people might not understand English. So if we can help translate and say this very complicated disease in a simple language, maybe they will understand. It will be a start of a conversation about it. So, Bilinga, other than Kiswahili, what else do you speak?
No, I speak Swahili the best. That's
right.
my first language.
Thank you. You got 2 for 1. That's fine. Rakia.
Okay. So I speak Hausa, and in Hausa it's called Dajin Bakin Mahaifa.
Okay.
Dajin Bakin Mahaifa. Yes. And the explanation is because people believe that it is caused by the spirits before. So Daji is something caused by things you don't see. Bakin Mahaifa is the direct translation of mouth of the womb.
Can you say it one more time? I interrupted you before. Can you say it one more time?
Dajin Bakin Mahaifa.
All right. Abba, to you.
Yes. Thank you. You see, one thing, let me just disclose that many of the African languages have no word for cancer. Now, we try to, in most of the cases, I can speak plus or minus about 9 languages, out of which the 9 languages, of course, the Hausa and Antioquia has mentioned Daji. And then in my own mother tongue, Kanuri, we call it Tuno. So, and Tuno is a general term given any abnormal growth. Now, this is a direct translation of abnormal growth, which technically only an explanation that will lead someone to understand this is a cancer, but it has not classified a cancer from other abnormal growth. And the rest of the other 7 languages that I can speak, they don't have a word of cancer, which is, I feel I interact with a couple of people and I ask, what does it call? Many people say, oh, we don't know. Even clinicians, my colleagues, doctors, healthcare practitioners, and they are experts. So they kind of define it with their own description, but it's not something that is perfectly fit into.
Right.
So in my tribe, I think for the last time, maybe just I will mention it. It's called Tuno, and Tuno is general terms for abnormal growth, not only cancer, which is not the perfect description.
Yeah, so one thing I've learned is that some languages, they just describe what the cervix is. So for example, in my mother's language, we call it kokoloyo mwagwanabana, which is cancer that is at the mouth of the uterus, the cervix. And I think I asked somewhere in the Hypo Africa group, and there's somebody who gave a description in isiZulu. I don't want to mispronounce it, but yes, and Nigeria, there was somebody who gave in Hausa, and in Yoruba, describing again cancer in cervical, that cancer that affects the cervix. And I think I'm bringing this up because as an advocacy group, I think it would be great to have at least the definition of cervical cancer for our people in the local languages. At least that's what my request to this group, to kind of find out what that can be, so that we can make this language or this disease a disease that is understandable by many. And with that, I really wanted to say thank you so much for this first of, I think, what I believe will be many series, because this is an important subject. I am committed to prioritizing these conversations around cervical cancer. And so I think I wanted, first of all, to say thank you to Faith. Thank you for sharing your experience. We're sorry that, for all the challenges you continue to go through as somebody trying to survive cervical cancer. And as an advocacy group, I think this is a great group to talk to, because this is one of the things they will be doing, advocating for survivors, patients, women, and all that. But before I say bye, just one word from each and every one of you to our viewers as we wrap this up. Just one word or one phrase, very quickly, starting with Abba.
Yeah. Thank you once again. I think cervical cancer is a treatable, preventable cancer. I will call for every woman should go for vaccination. That will reduce cervical cancer with 99%. Cervical cancer is preventable, is treatable. Please check your gynecologist. Thank you.
Thank you. Rakia?
Vaccinate the daughter, screen the mother.
Thank you. Belinga?
United we stand, divided we fall. So united we can beat cervical cancer. Thank you.
Thank you, Belinga. Faith?
What I can say, I'm a survivor. I'm a cervical cancer survivor. So you can make it the way I did it.